Sure will. Thanks, Maggie. Now to the latest on the pandemic here in the United States. We're joined by Dr. Todd Ellerin, infectious disease specialist, ABC News contributor. Dr. Ellerin, great to see you again. And we're seeing this promising news out of the UK. We're still waiting for vaccine approval here. So how far away are we? Does it make a huge difference, do you think?
Terry, we're so close right now. I mean, I can feel it. And you know that the FDA, we just heard that the ACIP gave, an almost unanimous vote to the Tier 1A category, the priority patients that are going to get this. And on the 10th, we're going to hear the FDA decide whether Pfizer gets the EUA for their vaccine. Once it does, those can be distributed, and we could be seeing this vaccine in our arms within a couple of weeks. Obviously, we don't know for sure, but it's exciting. Moderna's right around the corner, and hopefully we'll have millions of people vaccinated before the end of the year. That's not, most people. Most people will not be vaccinated till 2021. So we have to be patient. There's going to be a lot of people waiting and trying to figure out, where is my vaccine? It's coming, and it looks very good.
And it really is amazing the speed with which it's happened. We've also learned on living with the pandemic, the CDC is now updating its guidance on quarantine, shortening the length of time recommended that people quarantine after being exposed to COVID-19. Instead of 14 days, we're now talking about 7 days for those who are exposed, get a negative test, and 10 days for those who are exposed, but they get no test. So is that sound scientifically, do you think?
So it's definitely sociologic. And what I mean by that is there's a lot of quarantine fatigue. And if we're not quarantining at all, that is not going to help. So I think what the CDC is doing is the right thing, where they're saying if we can shorten that quarantine, then maybe more people will participate and follow that guidance. We don't want perfect to be the enemy of good. Remember this, 90% of people develop symptoms by 10 days. So that's going to, if you're quarantined for 10 days, then that's most people's infectivity period, okay? It's not perfect. The CDC is still saying ideally it's 14 days, but 10 days if you don't test. And then if you do test and have a negative result by day 7, you can come off of quarantine. That one caveat, that means you have to remain asymptomatic. This is not about patients who have symptoms.
It's so interesting to see how this pandemic has been managed, sort of sociologically, as you say, as well as medically. And CDC advisors are also making the recommendations now, as you were mentioning, on who should be first in line for that vaccine. Healthcare workers, long-term care facility residents. There are some schools that maybe you get the kids vaccinated. What's your reaction to the way the CDC is approaching it? Are those the right groups to target first?
These are tough decisions. I'm really happy that we have very smart people making them, and I think they made the right ones for Tier 1A. I'm going to explain this to you. They call it the multiplier effect. So they're looking for people that by getting vaccinated, they're not just helping that individual, but they're helping the community and the country as a whole. So if you take nursing home residents, they make up 6% of the pandemic, but they make up almost 40% of deaths. So by vaccinating them, they're the most vulnerable group, but also they're the group that when they come into the hospital, they're some of the most complicated patients, so they stay for very long periods of time. And we know that we're trying to make sure that we don't exceed hospital capacity, because if we do, then, as you know, things begin to shut down. That's an example of the multiplier effect. The same is true with healthcare workers. When you vaccinate them, you protect them, so you allow them to work so they can take care of the patients. You also allow us to continue vaccinating the public. So we're here to do that. So I think while it's a tough decision, I think the advisory committee to the CDC made the right one.
And it sounds right. And another decision they had to make, White House Coronavirus Task Force, they sent out a briefing this week telling governors only that Americans under the age of 40 who gather with people outside their household at Thanksgiving are, quote, dangerous to others, and they must isolate immediately, and that those over the age of 65 should not enter any indoor public spaces where anyone is unmasked. Those are pretty urgent warnings, but it was only sent by the White House Coronavirus Task Force to governors. Should this be a public message for this kind of warning?
You know, Terry, we're in a crisis right now. We heard Dr. Fauci mention that earlier. You know, we have to do drastic things. I do think that this message sounds sensible. The 65 and older, they're the most vulnerable age group. You know, the younger, the under 40, that's the group that's spreading the virus. That's another point about why it's too bad that we have to allocate vaccination. You mentioned before about younger kids. We know that younger people are spreading it. So ideally, you'd like to get the vaccines into them as well. Not that they're the vulnerable groups, but they're the ones that are really transmitting this to older, more vulnerable people. So, you know, there's a lot going on here. I do think the message is the right one. I hope the governors, you know, are able to disseminate that to their respective states.
Great. Dr. Todd Ellerin, always great to have you. Thanks very much.
Good. Take care, Derek.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.